Thank you. Good morning, Your Excellency, Your Royal Highness, esteemed Director General, Regional Director, distinguished ministers, representatives and guests. I am pleased to welcome you all to the 70th session of the Regional Committee of the WHO European Region. We are living in extraordinary times. For several months now, the fight against the virus is dominating our lives and our works. The physical and travel restrictions imposed on us to control the COVID-19 pandemic is preventing us from meeting under normal circumstances in person. Nevertheless, it is a privilege and honor for me to officially open this historic 70th session in my capacity of outgoing president of the 69th sessions of the Regional Committee for Europe. It is great to see that despite of the situation, we are able to convene this Regional Committee and to be virtually connected with all the delegations from across the entire WHO European region. I hope that through this Regional Committee we can convey a strong sign of unity to the world and show our political resolve to overcome this crisis together and to build a safer and healthier world for our populations in this region and globally, where no one is left behind. Usually at this point, the outgoing RC president would give a detailed account on what was discussed at the last Regional Committee. However, for the sake of time, I would propose to skip this year and simply refer to the summary report that was submitted to the 146th session of the Executive Board. I would like to immediately give the floor to the Regional Director, Dr. Hans Kluge, for his opening remarks. Dr. Kluge was elected by this Regional Committee with a large majority last year and was confirmed by the Executive Board in early February of this year. This is his first Regional Committee in his new capacity. And Dr. Kluge, you have the floor.
Your Royal Highness, Crown Princess of Denmark, Honourable President of the 69th session of the Regional Committee for Europe, Director General, Excellencies, Honourable Ministers, distinguished representatives and guests, it is really my honour and privilege to welcome you all to the 70th session of the WHO Regional Committee for Europe. Let me start by thanking Minister Magnus Heunicke, Danish Minister for Health and Senior Citizens, and outgoing RC69 President, for opening the session and for his continued support, especially in these last few challenging months, to help ensure the operational capability and business continuity of the regional office here in Copenhagen. As you can imagine, I very much, of course, would have hoped for my first Regional Committee as Regional Director to welcome and meet you in person here in the beautiful city and to discuss the future health priorities and directions for our region. But at the same time, I am very pleased to be virtually connected with all 53 member states of our region, and I'm very impressed to see such high-level attendance to this Regional Committee 70, a historical record of Ministers of Health attending themselves. The commitment that Member States have demonstrated during these last months and weeks in preparing for the meeting has been really astonishing. And this despite your vital work responding to the pandemic. To me, it reflects the level of importance that you attribute to the mandate of WHO and the interest that you have for its work. As already mentioned by the President, this session is in many ways historic and an important occasion to come together as a region, to demonstrate our solidarity with each other and the world, and to express our determination to improve the health and well-being of all people. I very much look forward to your interventions and our discussions later today and tomorrow. As you know, we had to reduce our agenda to the items of governance continuity and strategic orientation. However, in a way, it also offers us an opportunity to focus our attention on the most critical issues and priorities for our region in these challenging times. Finally, let me briefly explain why I'll be wearing a face mask during this 70th session, except of course for when I will speak. In principle, the conditions in this room do not require the wearing of a face mask. There is physical distance of at least 1.5 meters guaranteed, and the room is sufficiently ventilated. Still, through wearing the face mask, I want to express my solidarity with all the countries where the epidemic situation currently mandates for stricter regulations, but also for our health and social care workers in the region, who day by day put their own health at risk by taking care of patients of our communities. By this simple gesture, I also want to pay my respect to everyone who has lost a loved one, to everyone who has suffered or continues to suffer amidst this pandemic and the far-reaching social and economic disruption it continues to cause. Thank you and welcome again.
Thank you, Dr. Kluge. We shall now move to agenda item 1A, election of the President, Executive President, Deputy Executive President, and Rapporteur. And in accordance with Rule 10 of the Rules of Procedure of the Regional Committee, I shall now submit to you the nominations for officers of the 70th session of the Regional Committee as proposed by the Standing Committee at its 5th meeting on September 8. For the office of President, the nomination is Dr. Alexei Soy, Minister for Health, Kazakhstan. For the office of Executive President, the nomination is Dr. Søren Brostrøm from Denmark. For the office of Deputy Executive President, the nomination is Dr. Ivar Pajnović Franelić from Croatia. Moreover, for the office of Rapporteur, the nomination is Ms. Nora Kronig Romero from Switzerland. And may I seek your agreement for these nominations?
Solo che non sento però, scusa, aspetta un attimo.
Excuse me, I think we have to mute. There's one that's not muted. I am informed that there is a request from 2 members to take the floor. The delegate of Azerbaijan, you have the floor. We are calling out to the delegate of Azerbaijan. You have the floor, Azerbaijan. Okay, we just wait for getting connected to Azerbaijan, and then we move on to the delegation of the Netherlands. The Netherlands, you have the floor. Okay, we have to move on. We did not get connection to Azerbaijan or the Netherlands. If we don't get it now, then we have to move on. Okay, we have to move on then. And then I can conclude that I see no additional nominations have been made. So can I therefore take it that there is agreement of the Regional Committee on these proposals by the Standing Committee? Again. Thank you for that. So let me congratulate the newly elected officers of this 70th session and wish them the best of luck in fulfilling their mandate. And I invite the newly elected officers to take up their function remotely, with the exception of the executive president, who is with us here in Copenhagen. And before I hand over the chair to Dr. Soy, let me wish the new president, the regional director, and all of us a successful regional committee. We shall continue these sessions immediately.
Your Royal Highness, the Crown Princess of Denmark, Honorable President of the 69th session of the Regional Committee for Europe, esteemed Director General and the Regional Director of WHO, Excellencies, Honorable Ministers, distinguished representatives and guests, I am truly humbled by the trust and confidence that you have placed in me to assume this task of President of the 70th session of the WHO Regional Committee for Europe, which is being held virtually. First of all, I would like to express my thanks and appreciation to my predecessor, Mr. Magnus Heunicke, Minister for Health and the Senior Citizens of Denmark, for this contribution to the 69th session of the Regional Committee. I would also like to congratulate the other officers of the 70th Regional Committee of Europe and thank them in advance for their support in ensuring a proper conduct of this virtual session. I am particularly calling on the support of the Executive President to assist me in leading discussions. Dr. Bergström, presence at the WHO regional office in Copenhagen, will help to ensure a continued and smooth management of the session and the speakers list. I am very much looking forward to our exchanges and discussions. The European region has been historically at the forefront on many developments in global health. To name just one, the recognition of primary care as the key to achieving universal health coverage and sustainable development, as was also reaffirmed in the Astana Declaration. Also, in these challenging times, our region can be leading the way towards a new health paradigm. The discussion on the European program provides us with a great opportunity to reflect on how to prepare for the healthier and safer future for the population we serve. I want to thank the Regional Director for his leadership on this. Before starting our proceedings, it is first my privilege to welcome in Her Royal Highness, the Crown Princess of Denmark, patron of WHO Regional Office for Europe, who will now address the Regional Committee. Your Royal Highness, it is a great honor to have you with us. We really appreciate your presence here today. Please have the floor.
Director General, Regional Director, Chair, Dr. Alexis Soy, Honourable Ministers, distinguished guests, ladies and gentlemen. When I stood before you at last year's session of the WHO Regional Committee for Europe, I never imagined that 1 year later we would find ourselves in these extraordinary circumstances. It would have seemed incomprehensible had you told me that the next regional committee meeting would be delivered remotely, months into a pandemic that has held the region and much of the world in its grip since early spring. Now, as we face the worst global health crisis in 100 years, I'm reminded of the words of Winston Churchill, who once said, "I'm always ready to learn, although I do not always like being taught. The pandemic has proven to be a tough teacher, testing us when we didn't expect it and making us pay for our missteps. I am sure that you, as I, have experienced uncertainty, worry, and sadness in recent months as we try to find meaning in rapidly changing events, as we are unable to follow the familiar patterns of daily life, and as we are prevented from spending time with friends and loved ones. For many, the psychological, emotional, social, and economic costs of the pandemic will be felt for years to come. The pandemic has made even more clear the health inequities, an area of weaknesses that exist in our region. But while we have certainly been tested and taught these past months, we've also had the opportunity to learn a great deal collectively. To begin with, we have, as a society, learned, though for many of us this was never in doubt, that there can be no healthcare without the health workforce. Health workers are the backbone of our health services. These brave individuals have put themselves in danger to serve their fellow citizens. They have worked around the clock to respond to the pandemic and to keep other essential health and care services operating. They have and have earned, even more so, our deepest gratitude and respect, and they deserve our unwavering support. Indeed, how we succeed in combating COVID-19 depends on how we support our health workers. This includes training and preparing them so they have the tools they need to provide safe and appropriate information and care to their communities. We must protect their physical health, prioritise their mental health, and ensure they have the necessary support to ease their burden of worrying about their own home life, in addition to their life-saving work. I have been pleased to learn that as part of World Patient Safety Day taking place this week, WHO plans to launch a draft health worker safety charter dedicated to supporting our healthcare workforce and building a sustainable workforce for the future. There has never been a more important moment to prioritise health worker safety in our region, as it is directly linked to patient safety. Half of the health workforce in the European region is made up of nurses and midwives. This year, designated the International Year of the Nurse and the Midwife, we celebrate the pivotal contribution they make providing care throughout people's lives. As health systems change, nurses and midwives are taking on increasingly advanced and specialised roles, leading teams, conducting research, influencing and implementing policy, and educating the next generation. Through the COVID-19 emergency and beyond, we must invest in them and support them to reach their full potential. To all the nurses, midwives, health and care workers across the European region, you have my deepest respect and admiration, and I thank you. In my 15 years as patron of the WHO Regional Office for Europe, I've had the chance to focus on several specific health issues. Now, COVID-19 has added a new sense of urgencies to these areas. Maternal and child health in the region has always been a priority, and for many of you participating today. But the pandemic has put children and mothers at risk in alarming new ways. While most cases of COVID-19 in those aged 0 to 19 are mild, the consequences of the pandemic have been serious for this group. And we have reports from countries, civil society and academia confirming that violence against women and children has increased during the pandemic. We have learned the tremendous value of our education system in recent months, and we can see more clearly how closely linked it is with our health system and how vital it is in protecting children's health and well-being. As we move forward, public health approaches to the pandemic must take account of how they affect everyone, particularly children. Failure to prioritise maternal and child health during the recovery phase of the pandemic will reverse many of the encouraging gains made in the European region over the past decades. Perhaps no area is more vital to the health of newborns, children, and all of society than immunisation. I am a firm believer in the life-saving power of vaccines, and I have worked in partnership with the regional office to share the message that vaccination is a right and a responsibility for all. Prior to the pandemic, we have had many reasons to feel proud and encouraged by the results of our collective efforts to protect people from vaccine-preventable diseases. In 2019, 96% of children in the region received their first dose of measles and rubella-containing vaccine, the highest coverage ever reported. But the 100,000 measles cases reported across 45 countries in 2019, and now the rapid spread of COVID-19, clearly underline that infectious diseases know no borders. We all look forward to the day when a vaccine can protect us from COVID-19. It is my hope that when that day arrives, we will see a greater support of vaccines and respect for their power to protect and save lives. But our focus on this future milestone should not distract us from our work today to close the immunisation gap in the region with existing vaccines, particularly among the most vulnerable populations. While we sometimes struggle to convince people of the power and safety of vaccines, we also face challenges ensuring the safe and appropriate use of antibiotics. Fear of COVID-19 during this pandemic has given rise to more people attempting to prevent infection or self-medicate by using antibiotics incorrectly. We must remember that antibiotics only work against bacterial infections, and that inappropriate antibiotic use raises the risk of antibiotic resistance, and this puts everyone at risk, even from mild infections. We should make every effort to ensure that the crisis of antimicrobial resistance does not worsen as we work to fight the COVID-19 pandemic. As the first WHO European Strategic Action Plan to fight antibiotic resistance comes to a close, the region will take up a new action plan to guide and support countries in the coming years. This will be vital to meeting the challenge of AMR head-on. Before the pandemic made its mark on the European region, we already recognised that many great health challenges lay ahead. We knew it would take dedicated, tireless, collaborative action to reach our health goals, including SDG 3. This is the first regional committee session for our new regional director. I would like to commend you, Dr. Kluge, for your leadership, determination, and the collaborative spirit in which you have driven the region's response to COVID-19. Such qualities are evident in your vision of United Action for Better Health, the European programme of work to be discussed at this meeting. Facing a health emergency of unprecedented scope, we have learned that we must indeed stand united, or we cannot hope to achieve better health for all. As this group gathers virtually to map the way forward, I hope that we all have the humility to be taught and the openness to learn from what we have experienced individually and collectively during this pandemic and from each other. The path ahead may seem daunting. The challenges we face are indeed great. But I have faith in the dedication and bravery of our health workers and in the commitment and creativity of our health leaders and decision makers, in all of you. I look forward with great anticipation to coming together at the next regional committee, hopefully in person, and to listening, learning, and finding inspiration from each other. Working together to make the world a safer and healthier place for everyone is the most fitting of legacies to honour those we have lost as a result of this virus, and an invaluable gift to the children of the future. Thank you.
Thank you, Your Royal Highness, for reminding us of the invaluable role that nurses and midwives, as well as other health workers all over the world, have played over these past months in the response to the COVID-19 pandemic, but also in addressing other diseases and in taking care of all people suffering and in need of assistance. Their bravery, self-sacrifice, and solidarity humble and inspire us. Thank you also for sharing your thoughts with us and for your continued commitment to WHO's activities in the European region. Your support is highly appreciated, and we look forward to continuing working with you to promote and improve the health and well-being of all people in our region and beyond. Thank you. Before moving to our program, I would like to remind you that Rule 3 of the Regional Committee's Rules of Procedure requests the member states of the region to provide credentials before the opening of the meeting. In accordance with Section 12 of the Special Rules and Procedures, the credentials have been submitted electronically. Credentials were reviewed by the Committee on Credentials, appointed by the 27th SCRC at its fifth meeting last week. The committee met yesterday and concluded that all submitted credentials met the established requirements. Thank you to all member states for this effort. I would also like to inform you that all member states are represented. The quorum for this 70th session is largely reached.